Hey, Alpha Nurses and Licensure from alphanurseguy.com. This is 120 practice questions. Without the way, let's get started.
1 hour ago, a multipara was examined with the following results: 8 centimeters, 50% effaced, and plus 1 station. She is now pushing with contractions, and the fetal head is seen at the vaginal introitus. The nurse concludes that the client is now 1. 9 centimeters dilated, 70% effaced, and plus 2 station. 2. 9 centimeters dilated, 80% effaced, and plus 3 station. 3. 10 centimeters dilated, 90% effaced, and plus 4 station. 4. 10 centimeters dilated, 100% effaced, and plus 5 station. The correct answer is 4. 10 centimeters dilated, 100% effaced, and plus 5 station. In option 1 and 2, this client is still in stage 1, which is when the cervix is not fully effaced or fully dilated, and the station is high. In option 3, although this client is fully dilated, the cervix is not fully effaced, and the baby has not descended far enough. In option 4, the cervix is fully dilated and fully effaced, and the baby is low enough to be seen through the vaginal introitus. When performing Leopold maneuvers, the nurse notes that the fetus is in the left occiput anterior position. Which is the best position for the nurse to place a fetoscope to hear the fetal heartbeat? 1. Left upper quadrant. 2. Right upper quadrant. 3. Left lower quadrant. 4. Right lower quadrant. The correct answer is 3. Left lower quadrant. The left upper quadrant would be the appropriate place to place a fetoscope to hear the fetal heartbeat if the baby were in the left sacrum anterior position, not the left occiput anterior position. The right upper quadrant would be appropriate if the baby were in the right sacrum anterior position. The fetoscope should be placed in the left lower quadrant for a fetus positioned in the left occiput anterior position as described in the question. The right lower quadrant would be appropriate if the baby were in the right occiput anterior position. During a vaginal examination, the nurse palpates fetal buttocks that are facing the left posterior and are 1 centimeter above the ischial spines. Which of the following is consistent with this assessment? 1. LOA -1 station. 2. LSP -1 station. 3. LMP plus 1 station. 4. LSA plus 1 station. The correct answer is 2. LSP -1 station. The LOA position refers to a fetus whose occiput is facing toward the mother's left anterior, and a presenting part at -1 station is 1 centimeter above the ischial spines. The LSP position is the correct answer. The fetal buttocks are facing toward the mother's left posterior, and buttocks at -1 station are 1 centimeter above the ischial spines. The LMP position refers to a fetus whose face is facing toward the mother's LP, and a presenting part at +1 is 1 centimeter below the ischial spines. The LSA position refers to a fetus whose buttocks are facing toward the mother's LA, and a presenting part at +1 station is 1 centimeter below the ischial spines. The labor and delivery nurse is performing Leopold maneuvers. A soft round mass is felt in the fundal region. A flat object is noted on the left, and small objects are noted on the right of the uterus. A hard round mass is noted above the symphysis. Which of the following positions is consistent with these findings? 1. Left occipital anterior. 2. Left sacral posterior. 3. Right mentum anterior. 4. Right sacral posterior. The correct answer is 1. Left occipital anterior. The nurse's findings upon performing Leopold maneuvers indicate that the fetus is in the left occiput anterior position. That is, the fetal back is felt on the mother's left side. The small parts are felt on her right side. The buttocks are felt in the fundal region, and the head is felt above her symphysis. In the left sacral posterior position, the fetus's buttocks are facing toward the mother's left posterior. A hard round mass is felt in the fundal region, and a soft round mass is felt above the symphysis. In the right mentum anterior position, the fetus's face is facing toward the mother's right anterior, and small objects are felt on the right of the mother's abdomen with a flat area felt on the mother's left side. In the right sacral posterior position, the fetus's sacrum is facing the mother's right posterior, and a hard round mass is felt in the fundal region, while a soft round mass is felt above the symphysis. When during the latent phase of labor, should the nurse assess the fetal heart pattern of a low-risk woman, G1P0000? Select all that apply. 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. 4. Every 10 minutes. 5. Before ambulating. The correct answers are 1. After vaginal examinations. 2. Before administration of analgesics. 3. Periodically at the end of a contraction. And 5. Before ambulating. The nurse should assess the fetal heart after all vaginal examinations. The nurse should assess the fetal heart before giving the mother any analgesics. The fetal heart should be assessed periodically at the end of a contraction. The fetal heart pattern should be assessed every hour during the latent phase of a low-risk labor. It is not standard protocol to assess every 10 minutes. The nurse should assess the fetal heart before the woman ambulates. A woman has just arrived at the labor and delivery suite. To report the client's status to her primary healthcare practitioner, which of the following assessments should the nurse perform? Select all that apply. 1. Fetal heart rate. 2. Contraction pattern. 3. Urinalysis. 4. Vital signs. 5. Biophysical profile. The correct answers are 1. Fetal heart rate. 2. Contraction pattern. And 4. Vital signs. The nurse should assess the fetal heart before reporting the client's status to the healthcare provider. The nurse should assess the contraction pattern before reporting the client's status. A complete urinalysis would likely be ordered by the primary healthcare practitioner once the client has been officially admitted, but the test would not be performed during the initial assessment process. The nurse should assess the woman's vital signs before reporting her status. A biophysical profile is performed only if ordered by a healthcare practitioner. A woman who states that she thinks she is in labor enters the labor suite. Which of the following assessments will provide the nurse with the most valuable information regarding the client's labor status? 1. Leopold maneuvers. 2. Fundal contractility. 3. Fetal heart assessment. 4. Vaginal examination. The correct answer is 4. Vaginal examination. Leopold maneuvers, although performed on a woman in labor, assess for fetal position, not the progress of labor. Fundal contractility will assess for uterine contractions, but this is not the most valuable information. Assessment of the fetal heart is critically important in relation to fetal well-being, but it will not determine the progress of labor. A vaginal examination will provide the nurse with the best information about the status of labor. The nurse observes the unlicensed assistive personnel performing delegated tasks. Which action by the UAP requires immediate intervention? 1. The UAP measures the output of a client who had a transurethral resection of the prostate. 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. 3. The UAP encourages the client to drink a glass of water after the nurse has administered the oral antibiotic. 4. The UAP assists the client diagnosed with a urinary tract infection to the bedside commode every 2 hours. The correct answer is 2. The UAP tells the client taking bethanechol, whose urine is green, that something must be wrong for the urine to be such an odd color. A green-blue color indicates the client is taking bethanechol, a urinary stimulant used for clients with a neurogenic bladder. This is an expected color, and the UAP should not indicate that something is wrong with the client. In option 1, the urinary output should be measured frequently in a client who has had a transurethral resection of the prostate. The client will have bladder irrigation, and the indwelling catheter bag will need to be emptied frequently. The nurse would not intervene to stop this action. In option 3, the client should be encouraged to drink fluids. The nurse would not intervene to stop this action. In option 4, this action encourages bowel and urine continence and is part of falls prevention protocol. The nurse would not intervene to stop this action. The client diagnosed with glomerulonephritis is receiving trimethoprim sulfa. Which data indicates the medication is effective? 1. A urine-specific gravity of 1.010. 2. Urinalysis with 35 white blood count, high power field. 3. Urine pH of 6.9. 4. A negative urine leukocyte esterase. The correct answer is 4. A negative urine leukocyte esterase. A negative urine leukocyte esterase indicates the antibiotic trimethoprim sulfa is effective in treating the infection. Leukocytes and nitrates are used to determine bacteriuria and other sources of UTIs. Urine-specific gravity can indicate dehydration or water intoxication, but it will not provide information about a UTI. A microscopic value of 35 white blood count high power field indicates a UTI, not that the antibiotic is effective. The normal value is less than 5 WBC-HPF. Normal urine pH is 5.0 to 9.0, but the pH does not evaluate a UTI. The nurse in the long-term care facility is caring for a client with an indwelling catheter. Which preparation should the nurse order for the client? 1. Cranberry juice with breakfast daily. 2. Nitrofurantoin, 100 mg every 12 hours for 7 days. 3. Vitamin C every night at bedtime. 4. Golden Seal 2 milliliters in water, 2 to 3 times daily. The correct answer is 1. Cranberry juice with breakfast daily. Cranberry juice is acidic and will change the pH of the urine, making it harder for bacteria to survive in the environment. It can be used prophylactically to prevent UTIs. It does not treat an infection. The nurse can arrange with the dietitian to include this in the client's dietary plan. Nitrofurantoin, a sulfa drug, is a prescription medication that is used to treat chronic UTIs, but the nurse could not order this medication. In a long-term care facility, over-the-counter vitamin C would require an HCP order. Golden Seal is an herb used for UTIs, but in a long-term care facility, it would require an HCP order. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which laboratory data indicates the medication is effective? 1. A decreased serum potassium level. 2. A normal serum sodium level. 3. A decreased serum blood urea nitrogen level. 4. A normal serum phosphorus level. The correct answer is 4. A normal serum phosphorus level. Lanthanum carbonate, an electrolyte and water balancing agent, decreases phosphate absorption in the intestines, and the phosphorus is excreted in the feces. A decreased potassium level indicates the dialysis is effective, but not that the medication is effective. This medication does not affect sodium level. A decreased BUN level indicates the dialysis is effective, but not the medication. The client diagnosed with chronic kidney disease is receiving oral sodium polystyrene. Which assessment data indicates the medication is effective? 1. The client's serum potassium level is 5.8 milliequivalents per liter. 2. The client's serum sodium level is 135 milliequivalents per liter. 3. The client's serum potassium level is 4.2 milliequivalents per liter. 4. The client's serum sodium level is 147 milliequivalents per liter. The correct answer is 3. The client's serum potassium level is 4.2 milliequivalents per liter. Sodium polystyrene is a medication that is administered to decrease an elevated serum potassium level. A potassium level within the normal range of 3.5 to 5.2 milliequivalents per liter, like in option 3, indicates the medication is effective. The elevated serum potassium in option 1 would indicate the medication is not effective. Sodium polystyrene is not used to alter the serum sodium level. The client diagnosed with end-stage renal disease is taking calcitriol. Which assessment data warrants intervention by the nurse? 1. The client reports nausea. 2. The client has had 2 episodes of diarrhea. 3. The client has an increase in the serum creatinine level. 4. The client has blood in the urine. The correct answer is 4. The client has blood in the urine. Hematuria is an adverse effect of calcitriol, a vitamin D analog, and the nurse should notify the HCP. This would warrant taking the client off the medication. Nausea is a side effect of calcitriol and can also result from ESRD itself. Diarrhea is an expected side effect of the medication. Therefore, it would not warrant intervention from the nurse. The client in ESRD would have an increased serum creatinine level. Therefore, this would not warrant immediate intervention by the nurse. Which statement best describes the scientific rationale for administering aluminum hydroxide to a client diagnosed with chronic kidney disease? 1. This medication neutralizes gastric acid production. 2. It binds to phosphorus to help decrease hyperphosphatemia. 3. The medication is administered to decrease the calcium level. 4. It will help decrease episodes of constipation in the client with CKD. The correct answer is 2. It binds to phosphorus to help decrease hyperphosphatemia. Clients with CKD experience an increase in serum phosphorus levels, and administering aluminum hydroxide, an antacid, binds with phosphorus to be excreted in the feces. Option 1 is the scientific rationale for administering antacids to clients with peptic ulcer disease or gastritis, not clients with CKD. Aluminum hydroxide does not affect the calcium level. Aluminum hydroxide can cause constipation. It is not used to treat constipation. The client diagnosed with chronic kidney disease is prescribed apoetin. Which statement best describes the scientific rationale for administering this medication? 1. This medication stimulates red blood cell production. 2. This medication stimulates white blood cell production. 3. This medication is used to treat thrombocytopenia. 4. This medication increases the production of urine. The correct answer is 1. This medication stimulates red blood cell production. Epoetin, a biologic response modifier, is a glycoprotein produced by the kidney that stimulates red blood cell production in response to hypoxia. It is prescribed to treat the anemia that occurs in clients diagnosed with CKD. Filgrastim is the biological response modifier that stimulates WBCs and is not used in the treatment of CKD. Oprelvacin is the biological response modifier that stimulates megakaryocyte and thrombocyte production, which stimulates platelet production to prevent thrombocytopenia in clients receiving chemotherapy. There is no medication that increases the production of urine. Diuretics increase the excretion of urine, but do not affect the production of urine. The nurse is caring for a nulliparous client who attended Lamaze childbirth education classes. Which of the following techniques should the nurse include in her plan of care? Select all that apply. 1. Hypnotic suggestion. 2. Rhythmic chanting. 3. Muscle relaxation. 4. Pelvic rocking. 5. Abdominal massage. The correct answers are 3. Muscle relaxation. 4. Pelvic rocking. And 5. Abdominal massage. Hypnotic suggestion is usually not included in childbirth education based on the Lamaze method. Rhythmic chanting is usually not included in childbirth education based on the Lamaze method. Muscle relaxation is an integral part of Lamaze childbirth education. Pelvic rocking is taught in Lamaze classes as a way of easing back pain during pregnancy and labor. Abdominal massage, called effleurage, is also an integral part of Lamaze childbirth education. On examination of a full-term primipara, a labor nurse notes, active labor, right occiput anterior, 7 centimeters dilated, and plus 3 station. Which of the following should the nurse report to the healthcare provider? 1. Descent is progressing well. 2. Fetal head is not yet engaged. 3. Vaginal delivery is imminent. 4. External rotation is complete. The correct answer is 1. Descent is progressing well. The presenting part is 3 centimeters below the ischial spines. Descent is progressing well. The fetal head is well past engagement. Engagement is defined as 0 station. The woman, a primipara, is only 7 centimeters dilated. Delivery is likely to be many hours away. External rotation does not occur until after delivery of the fetal head. The nurse enters a laboring client's room. The client is complaining of intense back pain with each contraction. The nurse concludes that the fetus is likely in which of the following positions? 1. Mentum anterior. 2. Sacrum posterior. 3. occiput posterior. 4. Scapula anterior. The correct answer is 3. Occiput posterior. A fetus in the mentum anterior position is unlikely to elicit severe back pain in the mother. A fetus in the sacral posterior position is unlikely to elicit severe back pain in the mother. When a fetus is in the occiput posterior position, mothers frequently complain of severe back pain. A fetus in the scapula anterior position is unlikely to elicit severe back pain in the mother. A nurse is caring for a laboring woman who is in transition. Which of the following signs, symptoms would indicate that the woman is progressing into the second stage of labor? Select all that apply. 1. Bulging perineum. 2. Increased bloody show. 3. Spontaneous rupture of the membranes. 4. Uncontrollable urge to push. 5. Inability to breathe through contractions. The correct answers are 1. Bulging perineum, 2. Increased bloody show, and 4. Uncontrollable urge to push. A bulging perineum indicates progression to the second stage of labor. The bloody show increases as a woman enters the second stage of labor. The amniotic sac can rupture at any time. With a fully dilated cervix and bulging perineum, laboring women usually feel a strong urge to push. The gravita's ability to work with her labor is more dependent on her level of pain and her preparation for labor than on the phases and or stages of labor. The nurse is assessing the fetal station during a vaginal examination. Which of the following structures should the nurse palpate? 1. Sacral promontory. 2. Ischial spines. 3. Cervix. 4. Symphysis pubis. The correct answer is 2. Ischial spines. Palpating the sacral promontory assesses the obstetric conjugate, not the fetal station. Station is assessed by palpating the ischial spines. Palpating the cervix assesses dilation and effacement, not fetal station. Palpating the symphysis, pubis assesses the obstetric conjugate, not the fetal station. While performing Leopold maneuvers on a woman in labor, the nurse palpates a hard round mass in the fundal area, a flat surface on the left side, small objects on the right side, and a soft round mass just above the symphysis. Which of the following is a reasonable conclusion by the nurse? 1. The fetal position is transverse. 2. The fetal presentation is vertex. 3. The fetal lie is vertical. 4. The fetal attitude is flexed. The correct answer is 3. The fetal lie is vertical. With the palpation findings of a hard round mass in the fundal area and soft round mass above the symphysis, the nurse can conclude that the fetal position is not transverse. The nurse can conclude that the fetal lie is vertical. The attitude is difficult to determine when performing Leopold maneuvers. A client in labor, G2P1001, was admitted 1 hour ago at 2 centimeters dilated and 50% effaced. She was talkative and excited at that time. During the past 10 minutes, she has become serious, closing her eyes and breathing rapidly with each contraction. Which of the following is an accurate nursing assessment of the situation? 1. The client had poor childbirth education prior to labor. 2. The client is exhibiting an expected behavior for labor. 3. The client is becoming hypoxic and hypercapnic. 4. The client needs her alpha-fetoprotein levels checked. The correct answer is 2. The client is exhibiting an expected behavior for labor. There is no indication that this woman has had poor preparation for childbirth. The woman is showing expected signs of the active phase of labor. There is no indication that this woman is showing signs of hypoxia and/or hypercapnia. The alpha-fetoprotein assessment is a test to screen for Down syndrome and neural tube defects in the fetus. It is done during pregnancy. A client enters the labor and delivery suite stating that she thinks she is in labor. Which of the following information about the woman should the nurse note from the woman's prenatal record before proceeding with the physical assessment? Select all that apply. 1. Weight gain. 2. Ethnicity and religion. 3. Age. 4. Type of insurance. 5. Gravidity and parity. The correct answers are 1. Weight gain. 2. Ethnicity and religion. 3. age, and 5. Gravidity and parity. Before proceeding with a physical assessment, the nurse should check the client's weight gain reported in her prenatal record. The client's ethnicity and religion should be noted before physical assessment. This allows the nurse to proceed in a culturally sensitive manner. The client's age should also be noted before the physical assessment is begun. The type of insurance the woman has is not relevant to the nurse. The client's gravidity and parity, how many times she has been pregnant and how many times she has given birth, should also be noted before a physical assessment is begun. The nurse is administering medications to clients on a urology floor. Which medication should the nurse question? 1. Ceftriaxone to a client who is pregnant. 2. Cephalexin to a client who is allergic to penicillin. 3. Trimethoprim sulfa to a client post-prostate surgery. 4. Nitrofurantoin to a client diagnosed with urinary stasis. The correct answer is 2. Cephalexin to a client who is allergic to penicillin. A cross-sensitivity exists in some clients between penicillin and cephalosporins, such as cephalexin. The nurse should assess the type of reaction that the client experienced when taking penicillin. If the client indicates any symptom of an anaphylactic reaction, the nurse will hold the medication and discuss the situation with the HCP. Ceftriaxone, a third-generation cephalosporin, is in the pregnancy risk category B. No research has shown harm to the fetus in humans or in animals. The nurse would not question this medication. There is no reason for the nurse to question trimethoprim sulfa, a sulfa antibiotic, for a client who has had prostate surgery. There is no reason for the nurse to question nitrofurantoin, a sulfa antibiotic, for a client who has urinary stasis. Nitrofurantoin is used to prevent or treat chronic UTIs. The male client is admitted to the medical floor with a diagnosis of pyelonephritis. Which intervention should the nurse implement first? 1. Initiate IV access with a 20-gauge catheter. 2. Administer the IV antibiotic within 2 hours of admission. 3. Obtain a urine specimen for culture and sensitivity. 4. Notify the dietary department to order the client a regular diet. The correct answer is 3. Obtain a urine specimen for culture and sensitivity. The nurse should obtain a clean voided midstream specimen for culture and sensitivity before initiating the antibiotics. This is the first intervention to implement. The IV is important to initiate therapy, but the nurse should obtain a clean voided midstream urine for culture and sensitivity before initiating the treatment. If the culture is not obtained prior to initiating the antibiotic, the results of the laboratory test will be skewed. A diet order is not a priority over getting the treatment started. UTIs in males are difficult to treat and can be life-threatening. The client diagnosed with chronic kidney disease on hemodialysis is prescribed lanthanum carbonate. Which interventions should the nurse discuss with the client? Select all that apply. 1. Chew the tablets completely before swallowing. 2. Monitor the dialysis graft for bleeding. 3. Take an over-the-counter proton pump inhibitor. 4. Check the radial pulse prior to taking the medication. 5. Take the medication with or right after meals. The correct answers are 1. Chew the tablets completely before swallowing, and 5. Take the medication with or right after meals. Lanthanum carbonate, an electrolyte and water balancing agent, should not be swallowed. The medication must be chewed for absorption in the intestines. Lanthanum carbonate should be taken with or right after meals. Lanthanum carbonate may cause graft occlusion, not bleeding. Lanthanum carbonate does not increase gastric acid secretion. Therefore, the client would not need to take a proton pump inhibitor. Lanthanum carbonate may cause hypotension, and the blood pressure must be checked, not the pulse rate. The nurse is administering hydrochlorothiazide to a client diagnosed with chronic kidney disease. Which assessment data should cause the nurse to question the administration of this medication? Select all that apply. 1. The client's skin turgor on the upper chest is tented. 2. The urine output was 90 milliliter for the last 8 hours. 3. The client's oral mucosa is moist and pink. 4. The client has 3+ sacral and peripheral edema. 5. The client's blood pressure is 90/60 in the left arm. The correct answers are 1. The client's skin turgor on the upper chest is tented, and 5. The client's blood pressure is 90/60 in the left arm. Tented skin turgor indicates the client is dehydrated, and the nurse should question administering the thiazide diuretic hydrochlorothiazide. Diuretics reduce circulating blood volume, which may cause orthostatic hypotension. Because the client's blood pressure is low, the nurse should question administering this medication. The client with CKD would have a less than normal urine output, so the nurse would not question giving the client a diuretic. A moist and pink mucosa indicates the client is hydrated. Therefore, the nurse would not question administering this medication. In option 4, the medication is being administered to help decrease the sacral edema. Therefore, the nurse would not question administering this diuretic. The client diagnosed with chronic kidney disease is taking aluminum hydroxide liquid. Which information should the nurse discuss with the client? 1. Drink at least 500 milliliter of water after taking the medication. 2. Do not drink any water for 1 hour after taking the medication. 3. Drink 2 to 4 ounces of water after taking the medication. 4. Eat 30 minutes prior to taking the aluminum hydroxide. The correct answer is 3. Drink 2 to 4 ounces of water after taking the medication. Liquid antacids should be taken with 2 to 4 ounces of water to ensure that the medication reaches the stomach. The client should not drink more than 4 ounces of water because water quickens the gastric emptying time. Antacids should be taken on an empty stomach and are effective for 30 to 60 minutes before passing into the duodenum. Which statement best describes the scientific rationale for administering calcitriol to a client diagnosed with end-stage renal disease? 1. This medication increases the availability of vitamin D in the intestines. 2. This medication stimulates excretion of calcium from the parathyroid gland. 3. This medication helps the body excrete calcium through the feces. 4. This medication increases serum calcium levels by promoting calcium absorption. The correct answer is 4. This medication increases serum calcium levels by promoting calcium absorption. Calcitriol, a vitamin D analog, increases serum calcium levels by promoting calcium absorption and thereby helps to manage hypocalcemia, which is a symptom of chronic kidney disease. Calcitriol does not affect the availability of vitamin D. Calcitriol is used to treat hypoparathyroidism, but it does not stimulate excretion of calcium from the parathyroid gland. The client in ESRD has hypocalcemia, not hypercalcemia. Which intervention should the nurse implement when administering epoetin subcutaneously? Select all that apply. 1. Do not shake the vial prior to preparing the injection. 2. Apply a warm washcloth after administering the medication. 3. Discard any unused portion of the vial after pulling up the correct dose. 4. Keep the medication vials in the refrigerator until preparing to administer. 5. Administer the medication intramuscularly in the deltoid muscle. The correct answers are 1. Do not shake the vial prior to preparing the injection. 3. Discard any unused portion of the vial after pulling up the correct dose. And 4. Keep the medication vials in the refrigerator until preparing to administer. Do not shake the vial because shaking may denature the biological response modifier, epoetin, rendering it biologically inactive. The nurse should only use the vial for 1 dose. The nurse should not re-access the vial and should discard any unused portion because the vial contains no preservatives. The medication should be stored in the refrigerator and should be warmed to room temperature prior to its being administered. The nurse should apply ice to numb the injection site, not a warm washcloth after administration. This injection is administered subcutaneously, not intramuscularly. Which is a recommended guideline for safe computerized charting? 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting. A nurse witnesses an accident and assists the victim who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? 1. Seek consent from the injured party before rendering assistance. 2. Implement every critical care intervention necessary to sustain life. 3. Stay on the scene until another qualified person takes over responsibility. 4. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is 3. Stay on the scene until another qualified person takes over responsibility. When a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice. Which element of ethical practice is associated with fair policies and procedures guiding allocation of organs for transplantation? 1. Justice. 2. Fidelity. 3. Veracity. 4. Non-maleficence. The correct answer is 1. Justice. Justice refers to fairness and that all patients should be treated equally, impartially, and without prejudice regardless of individual factors. Fidelity refers to making only promises or commitments that can be kept. Veracity refers to being truthful, which is essential to a trusting nurse-patient relationship. Non-maleficence refers to preventing harm, avoiding actions that can cause harm, or removing a patient from harm. A nurse initiates a visit from a member of the clergy for a patient. How is the nurse functioning when initiating this visit? 1. Interdependently. 2. Independently. 3. Dependently. 4. Collegially. The correct answer is 2. Independently. A nurse does not need a primary healthcare provider's order to make a referral to a member of the clergy. An interdependent intervention requires a primary healthcare provider's order associated with a parameter. When a nurse initiates a referral to a member of the clergy, the nurse is working independently. A nurse can make a referral to a member of the clergy. This action is within the scope of nursing practice. The nurse can make a referral to a member of the clergy without collaborating with another professional healthcare team member. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? 1. State Boards of Nursing. 2. American Nurses Association. 3. Sigma Theta Tau International. 4. Constituent Leagues of the National League for Nursing. The correct answer is 1. State Boards of Nursing. The National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? 1. Document the patient's refusal to take the medication. 2. Discuss with a family member the need for the patient to take the medication. 3. Explain again to the patient the consequences of refusing to take the medication. 4. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is 1. Document the patient's refusal to take the medication. Withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time. A nurse administers an incorrect dose of medication to a patient. Which is the primary purpose of documenting this event in an incident report? 1. Record the event for future litigation. 2. Provide a basis for designing new policies. 3. Prevent similar situations from happening again. 4. Ensure accountability for the cause of the accident. The correct answer is 3. Prevent similar situations from happening again. Risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts. An infant with heart failure is receiving diuretic therapy, and the nurse is closely monitoring the intake and output. Which is the best method for the nurse to use to monitor the urine output? 1. Weighing the diapers. 2. Inserting a Foley catheter. 3. Comparing intake with output. 4. Measuring the amount of water added to formula. The correct answer is 1. Weighing the diapers. The best method to monitor urine output in an infant on diuretic therapy is to weigh the diapers. The weight of dry diapers is subtracted from the weight of wet diapers to determine the amount of urine excreted. 1 gram is equivalent to 1 milliliter of urine. Comparing intake with output would not provide an accurate measure of urine output. Measuring the amount of water added to formula is unrelated to the amount of output. Although Foley catheter drainage is most accurate in determining output, it is not the best method and places the infant at risk for infection. The nurse is caring for a child with a suspected diagnosis of rheumatic fever. The nurse reviews the laboratory results. Which laboratory study should assist in confirming the diagnosis of rheumatic fever? 1. Immunoglobulin. 2. Red blood cell count. 3. Antistreptolysin O titer. 4. White blood cell count. The correct answer is 3. Antistreptolysin O titer. A diagnosis of rheumatic fever is confirmed by the presence of 2 major manifestations, or 1 major and 2 minor manifestations from the Jones criteria. In addition, evidence of a recent streptococcal infection is confirmed by a positive antistreptolysin O titer streptozyme or an anti-DNase B assay. Options 1, 2, and 4 will not assist in confirming the diagnosis of rheumatic fever. The nurse is assigned to care for an infant with a diagnosis of tricuspid atresia. The nurse plans care, knowing which is true regarding this diagnosis. 1. A single vessel overrides both ventricles. 2. Frequent episodes of hypercyanotic spells occur. 3. There is no communication from the right atrium to the right ventricle. 4. There is no communication from the systemic and pulmonary circulations. The correct answer is 3. There is no communication from the right atrium to the right ventricle. In tricuspid atresia, there is no communication from the right atrium to the right ventricle. Option 1 describes truncus arteriosus. Option 4 describes transposition of the great arteries. In Option 2, frequent episodes of hypercyanotic spells occur in tetralogy of Fallot. A healthcare provider has prescribed oxygen as needed for a 10-month-old infant with heart failure. In which situation should the nurse administer the oxygen to the child? 1. When the child is sleeping. 2. When changing the child's diapers. 3. When the mother is holding the child. 4. When drawing blood for electrolyte levels. The correct answer is 4. When drawing blood for electrolyte levels. Oxygen administration may be prescribed for the infant with HF for stressful periods, especially during bouts of crying or invasive procedures. Drawing blood is an invasive procedure that would likely cause the child to cry. The nurse monitors the daily weight of an infant with heart failure, which finding alerts the nurse to suspect fluid accumulation and thus the need to notify the charge nurse. 1. bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. The correct answer is 4. A weight gain of 1 pound in 1 day. A weight gain of 0.5 kilogram or 1 pound in 1 day is a result of the accumulation of fluid. The nurse should monitor the urine output, monitor for evidence of facial or peripheral edema, check the lung sounds, and report the weight gain. Tachypnea and an increased blood pressure would occur with fluid accumulation. Diaphoresis is a sign of HF, but it is not specific to fluid accumulation, and it usually occurs with exertional activities. The nurse assists with admitting a child with a diagnosis of acute stage Kawasaki disease. When obtaining the child's medical history, which manifestation is likely to be noted? 1. Cracked lips. 2. A normal appearance. 3. Conjunctival hyperemia. 4. Desquamation of the skin. The correct answer is 3. Conjunctival hyperemia. During the acute stage of Kawasaki disease, the child presents with fever, conjunctival hyperemia, a red throat, swollen hands, a rash, and enlargement of the cervical lymph nodes. During the subacute stage, cracking lips and fissures, desquamation of the skin on the tips of the fingers and toes, joint pain, cardiac manifestations, and thrombocytosis occur. During the convalescent stage, the child appears normal, but signs of inflammation may be present. The nurse is told that a child with rheumatic fever will be arriving to the nursing unit for admission. Which question should the nurse ask the family to elicit information specific to the development of RF? 1. Has the child complained of back pain? 2. Has the child complained of headaches? 3. Has the child had any nausea or vomiting? 4. Did the child have a sore throat or a fever within the past 2 months? The correct answer is 4. Did the child have a sore throat or a fever within the past 2 months? Rheumatic fever characteristically presents 2 to 6 weeks after an untreated or partially treated Group A beta hemolytic streptococcal infection of the upper respiratory tract. Initially, the nurse determines if the child has had a sore throat or an unexplained fever within the past 2 months. Options 1, 2, and 3 are unrelated to RF. The nurse reviews the record of a child who was just seen by a healthcare provider. The HCP has documented a diagnosis of suspected aortic stenosis. Which specific sign-symptom of aortic stenosis should the nurse anticipate? 1. Pallor. 2. Hyperactivity. 3. Exercise intolerance. 4. Gastrointestinal disturbances. The correct answer is 3. Exercise intolerance. The child with aortic stenosis shows signs of exercise intolerance, chest pain, and dizziness when standing for long periods. Pallor may be noted, but it is not specific to this type of disorder alone. Options 2 and 4 are not related to this disorder. An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? 1. Slander. 2. Battery. 3. Assault. 4. Libel. The correct answer is 3. Assault. This scenario is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a falsely spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation. A faculty member of a nursing program is conducting an informational session for potential nursing students. Which information about licensure to practice nursing upon completion of a nursing program should the faculty member include in the session? 1. It is a responsibility of the American Nurses Association. 2. It is granted on graduation from a nursing program. 3. It is approved by the National League for Nursing. 4. It is required by law in each individual state. The correct answer is 4. It is required by law in each individual state. The American Nurses Association standards of clinical nursing practice do not address licensure. When a person graduates from a school of nursing, the individual receives a diploma that indicates completion of a course of study. The diploma is not a license to practice nursing. The National League for Nursing promotes nursing service and nursing education. It is not involved with licensure. The Nurse Practice Act in a state stipulates the requirements for licensure within the state. A primary healthcare provider orders out of bed to a chair as the activity level for a patient. How is the nurse functioning when moving this patient out of bed to a chair? 1. Interdependently. 2. Collaboratively. 3. Independently. 4. Dependently. The correct answer is 4. Dependently. Determining the extent of activity desirable for a patient is within the primary healthcare provider's, not a nurse's, scope of practice. Following activity orders is a dependent function of the nurse. A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? 1. Code of Ethics. 2. Informed Consent. 3. Nurse Practice Act. 4. Constitution of the United States. The correct answer is 2. Informed Consent. Informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? 1. To strengthen the defense. 2. To support the prosecution. 3. To present standards of nursing care as they apply to the facts in the case. 4. To make judgments associated with laws governing the practice of nursing. The correct answer is 3. To present standards of nursing care as they apply to the facts in the case. The American Nurses Association standards of clinical nursing practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence. When caring for a terminally ill patient, a family member says, "I need your help to hasten my mother's so that she is no longer suffering." Which should the nurse do, based on the position of the American Nurses Association in relation to assisted? 1. Not participate in active euthanasia. 2. Participate based on personal values and beliefs. 3. Participate when the patient is experiencing severe pain. 4. Not participate unless 2 primary healthcare providers are consulted and the patient has had counseling. The correct answer is 1. Not participate in active euthanasia. Nursing actions must comply with the law, and the law states that euthanasia is legally wrong. Euthanasia can lead to criminal charges of homicide or civil lawsuits for providing an unacceptable standard of care. A nurse's beliefs, values, or moral convictions should not be imposed on patients. Compassion and good intentions are not an acceptable basis for actions beyond the scope of nursing practice. Nurses, as well as other healthcare providers, cannot legally be involved with euthanasia. In some states in the United States, a primary healthcare provider can prescribe a medication that can be taken by a patient to cause death. The American Nurses Association, according to its Code for Nurses with Interpretive Statement, indicates that nurses should not participate in active euthanasia. When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? 1. Inform the supervisor. 2. Give the drug as prescribed. 3. Give the average dose of the medication. 4. Discuss the prescription with the primary healthcare provider. The correct answer is 4. Discuss the prescription with the primary healthcare provider. Nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." Which should the nurse do? 1. Ask what the other pill looked like. 2. Explain the purpose of the medication. 3. Check the original medication prescription. 4. Encourage the patient to take the medication. The correct answer is 3. Check the original medication prescription. Option 3 is the safest intervention because it goes to the original source of the prescription. Option 2 ignores the patient's concern. Option 1 is unsafe because the patient is confused and the information obtained may be inaccurate. Option 4 ignores the patient's statement and is unsafe without first obtaining additional information. The nurse is caring for a child with a diagnosis of Kawasaki disease. The mother of the child asks the nurse about the disorder. Which statement most accurately describes Kawasaki disease? 1. It is an acquired cell-mediated immunodeficiency disorder. 2. It is a chronic multisystem autoimmune disease characterized by the inflammation of connective tissue. 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. 4. It is an inflammatory autoimmune disease that affects the connective tissue of the heart, joints, and subcutaneous tissues. The correct answer is 3. It is also called mucocutaneous lymph node syndrome and is a febrile generalized vasculitis of unknown cause. Kawasaki disease, also called mucocutaneous lymph node syndrome, is a febrile generalized vasculitis of unknown etiology. Option 1 describes human immunodeficiency virus infection. Option 2 describes systemic lupus erythematosus. Option 4 describes rheumatic fever. Prostaglandin E1 is prescribed for a child with transposition of the great arteries. The mother of the child asks the nurse why the child needs the medication. The nurse correctly responds that which is the purpose of this medication. 1. Maintains an adequate hormone level. 2. Prevents hypercyanotic spells. 3. Maintains the position of the great arteries. 4. Provides adequate oxygen saturation and maintains cardiac output. The correct answer is 4. Provides adequate oxygen saturation and maintains cardiac output. A child with transposition of the great arteries may receive prostaglandin E1 temporarily to increase blood mixing if systemic and pulmonary mixing are inadequate to maintain adequate cardiac output. Options 1, 2, and 3 are incorrect. In addition, hypercyanotic spells occur in tetralogy of Fallot. The nurse is preparing to administer digoxin to an infant with heart failure. Before administering the medication, the nurse double-checks the dose, counts the apical heart rate for 1 full minute, and obtains a rate of 88 beats per minute. Based on this finding, which is the appropriate nursing action? 1. Withhold the medication. 2. Administer the medication. 3. Double-check the apical heart rate and administer the medication. 4. Check the blood pressure and respiration and administer the medication. The correct answer is 1. Withhold the medication. Digoxin is effective within a narrow therapeutic range. Safety in dosing is achieved by double-checking the dose and counting the apical heart rate for 1 full minute. If the heart rate is less than 100 beats per minute in an infant, the nurse should withhold the dose and notify the healthcare provider. The remaining options are incorrect actions. The nurse provides home care instructions to the parents of a child with heart failure regarding the procedure for the administration of digoxin. Which statement by a parent indicates the need for further teaching? 1. I will not mix the medication with food. 2. If more than 1 dose is missed, I will call the healthcare provider. 3. I will take my child's pulse before administering the medication. 4. If my child vomits after medication administration, I will repeat the dose. The correct answer is 4. If my child vomits after medication administration, I will repeat the dose. The parents need to be instructed that if the child vomits after the digoxin is administered, they are not to repeat the dose. Options 1, 2, and 3 are accurate instructions regarding the administration of this medication. Additionally, the parents should be instructed that if a dose is missed and it is not noticed until 4 hours later, the dose should not be administered. The nurse caring for an infant with congenital heart disease is monitoring the infant closely for signs of heart failure. The nurse should observe for which early sign of heart failure? 1. Pallor. 2. Cough. 3. Tachycardia. 4. Slow and shallow breathing. The correct answer is 3. Tachycardia. The early signs of rheumatic fever include tachycardia, tachypnea, profuse scalp sweating, fatigue, irritability, sudden weight gain, and respiratory distress. A cough may occur with HF as a result of mucosal swelling and irritation, but it is not an early sign. Pallor may be noted in the infant with heart failure, but it is also not an early sign. Acetyl-salicylic acid is prescribed for a child with rheumatic fever. The nurse should question this prescription if the child had documented evidence of which condition? 1. Arthralgia. 2. Joint pain. 3. Facial edema. 4. A viral infection. The correct answer is 4. A viral infection. Anti-inflammatory agents, including aspirin, may be prescribed by the healthcare provider for the child with RF. Aspirin should not be given to a child who has chickenpox or other viral infections, such as influenza, because of the risk of Reyes syndrome. Options 1 and 2 are clinical manifestations of RF. Facial edema may be associated with the development of a cardiac complication. The nurse has reinforced home care instructions to the mother of a child who is being discharged after cardiac surgery. Which statement by the mother indicates the need for further teaching? 1. A balance of rest and exercise is important. 2. I can apply lotion or powder to the incision if it is itchy. 3. Activities during which the child could fall need to be avoided for 2 to 4 weeks. 4. Large crowds of people need to be avoided for at least 2 weeks after the surgery. The correct answer is 2. I can apply lotion or powder to the incision if it is itchy. The mother should be instructed that lotions and powders should not be applied to the incision site because these items can affect the skin integrity and the healing process. Options 1, 3, and 4 are accurate instructions regarding home care after cardiac surgery. A nurse is caring for a client who is exposed to a stressful event. Which statement about the general adaptation syndrome should the nurse consider when caring for this client? 1. A stressful event is an iatrogenic stress. 2. An individual exposed to a stressful event will adapt in a unique way. 3. A stressful event will precipitate an autonomic nervous system response. 4. An individual exposed to a stressful event eventually will achieve homeostasis. The correct answer is 3. A stressful event will precipitate an autonomic nervous system response. Rationale. Stressors precipitate the general adaptation syndrome, which is a neuroendocrine response and part of the autonomic nervous system. A nurse gives a client in a nursing home a choice about which color shirt to wear. Which level need, according to Maslow's hierarchy of needs, has the nurse just met? 1. Self-esteem. 2. Physiological. 3. Safety and security. 4. Love and belonging. The correct answer is 1. Self-esteem. Rationale. Choosing which color shirt to wear provides a person with the opportunity to make a choice and supports feelings of independence, competence, and self-respect, which all contribute to a positive self-esteem. A nurse cares for a group of clients. A client experiencing which of the following situations does the nurse anticipate will have the hardest time coping? 1. Scheduled for a biopsy. 2. Unable to control the course of illness. 3. Challenged by a multiplicity of stressors. 4. Having to relocate to an assisted living facility. The correct answer is 3. Challenged by a multiplicity of stressors. Rationale. As the multiplicity of stressors increases, it becomes harder for a person to cope. As each stress is added, the accumulated impact is greater than just the sum of each individual stressor. Which is the primary purpose of the American Nurses Association Standards of Clinical Nursing Practice? 1. Define the philosophy of nursing practice. 2. Establish criteria for quality nursing practice. 3. Identify the legal definition of nursing practice. 4. Determine educational standards for nursing practice. The correct answer is 2. Establish criteria for quality nursing practice. The American Nurses Association Standards of Clinical Nursing Practice describe the nature and scope of nursing practice and the responsibilities for which nurses are accountable. A philosophy incorporates the values and beliefs about the phenomena of concern to a discipline. The American Nurses Association Standards of Clinical Nursing Practice reflect, not define, a philosophy of nursing. Each nurse and nursing organization should define its own philosophy of nursing. The laws of each state define the practice of nursing within the state. Educational standards are established by accrediting bodies, such as the National League for Nursing Accrediting Commission, the Commission on Collegiate Nursing Education, and state education departments. Nursing practice is influenced by the doctrine of respondite superior. Which is the basic concept related to this theory of liability? 1. Nurses must respond to the Supreme Court when they commit acts of malpractice. 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. 3. Nurses are responsible for their actions when they have contractual relationships with clients. 4. The law absolves nurses from being sued for negligence if they provide inappropriate care at the scene of an accident. The correct answer is 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. The ancient legal doctrine respondite superior means let the master answer. By virtue of the employer-employee relationship, the employer is responsible for the conduct of its employees. This is unrelated to respondite superior. Negligence and malpractice, which are unintentional torts, are litigated in local courts by civil actions between individuals. Individual responsibility is unrelated to respondite superior. A nurse can have an independent contractual relationship with a client. When a nurse works for an agency, the contract between the nurse and client is implied. In both instances, the nurse is responsible for the care provided. This is unrelated to respondite superior. Good Samaritan laws do not provide absolute immunity. Nurses must function as a reasonable, prudent nurse would function in a similar situation. Nurses can be held responsible if there is gross departure from the normal standard of care or if there is willful wrongdoing on the nurse's part. A nurse completes an incident report after a client falls while getting out of bed unassisted. Which is the purpose of this report? 1. Ensure that all parties have an opportunity to document what happened. 2. Help establish who is responsible for the situation. 3. Make data available for quality control analysis. 4. Document the situation on the client's chart. The correct answer is 3. Make data available for quality control analysis. Incident reports help to identify patterns of risk so that corrective action plans can take place. The nurse who identified or created the potential or actual harm completes the incident report. The report identifies the people involved in the incident, describes the incident, and records the date, time, location, actions taken, and other relevant information. Documentation should be as factual as possible and avoid accusations. Questions of liability are the responsibility of the courts. An incident report is not part of the client's clinical record, and reference to the report should not be made in the client's clinical record. A nurse must administer a medication. Which should the nurse do first? 1. Verify the prescription for accuracy. 2. Check the client's identification armband. 3. Ensure the medication is in the medication cart. 4. Determine the appropriateness of the prescribed medication. The correct answer is 1. Verify the prescription for accuracy. The administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the client, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. Although checking the client's identification armband is essential for the safe administration of a medication, it is not the first step when preparing to administer a medication to a client. Although ensuring that the medication is available may be done as a time management practice, it is not the first step when preparing to administer a medication to a client. A nurse is legally responsible for the safe administration of medications. Therefore, the nurse should assess if a medication prescription is reasonable. However, this is not the first step when preparing to administer a medication to a client. Which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump? 1. The uterus periodically becomes hard and firm. 2. The client reports an urgency to void. 3. The client denies the urge to push. 4. The fetal heart rate does not return to baseline. The correct answer is 4. The fetal heart rate does not return to baseline. During a contraction, the fetal heart rate will decrease, but should return to the baseline fetal heart rate after the contraction. If this does not occur, it indicates the infant is in distress, and this warrants immediate intervention. This could also be a sign of uterine rupture resulting from overstimulation of the uterus. The oxytocin infusion should be stopped immediately. The uterus becoming hard and firm periodically indicates a contraction, which is expected when administering a uterine stimulant. The client wanting to urinate would be expected because the baby's head is pushing against the bladder. Denying the urge to push indicates the client is not in the last stages of labor. The nurse is preparing to administer topical benzocaine to a client with a 4th-degree episiotomy. Which interventions should the nurse implement? Rank in order of performance. 1. Position the client on the side with top leg up and forward. 2. Wash hands and don non-sterile examination gloves. 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 5. Apply the benzocaine to the perineal area. The correct order is 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 2. Wash hands and don non-sterile examination gloves. 1. Position the client on the side with top leg up and forward. And 5. Apply the benzocaine to the perineal area. The nurse must first determine if this is the right client receiving the right medication. The nurse should always check for allergies. With this medication, cane drugs are anesthetics, and if the client is allergic to lidocaine or novocaine, the client should not receive this medication. Once the nurse determines that this is the right client to receive the right medication and that the client has no allergies, then the nurse must wash his or her hands and use gloves to administer a medication to the perineal area. The position on the side with top leg up and forward allows maximum exposure to the area that should be medicated. After completing all the previous steps, the nurse can apply the medication. The nurse is teaching a pregnant client diagnosed with tuberculosis infection about treatments during pregnancy and effects on her newborn. Which statement indicates the client understands the client teaching? 1. My baby will be born with TB and will be given isoniazid to treat the infection. 2. I will not be able to breastfeed, or my newborn could contract TB. 3. I should take supplemental pyridoxine during my pregnancy. 4. I will not take any medications to treat my TB until I have delivered my baby. The correct answer is 3. I should take supplemental pyridoxine during my pregnancy. Pyridoxine is recommended for pregnant clients with TB infections to ensure the fetus gets necessary vitamins. The infant will be tested for congenital TB. However, perinatal transmission is rare. Breastfeeding is not contraindicated in latent TB. Isoniazid, rifampin, and ethambutol are taken daily during pregnancy for treatment of TB. The nurse is preparing an amnio infusion for a client who is experiencing severe variable decelerations of the fetal heart rate. Which solution should the nurse expect to administer through the intrauterine pressure catheter? Select all that apply. 1. Normal saline. 2. 5% dextrose in water. 3. Lactated Ringer's solution. 4. Albumin 25% solution. 5. Dextrose and saline. The correct answers are 1. Normal saline, and 3. Lactated Ringer's solution. Normal saline is used in amnioinfusion. It can cause slight changes in fetal electrolytes, but is an acceptable fluid. Lactated Ringer's solution is the preferred fluid for amnioinfusion. 5% dextrose in water is not indicated for amnioinfusion. Albumin is a blood product prepared from plasma and is not used for this procedure. Dextrose in saline is not indicated for amnioinfusion. The nurse is preparing to administer medications in the antepartum unit. Which medication should the nurse question administering? 1. Terbutaline to a client preparing for an external cephalic version. 2. Hydralazine to a client diagnosed with preeclampsia. 3. Methotrexate to a client with an ectopic pregnancy. 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. The correct answer is 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. Prochlorperazine is contraindicated in pregnancy. Ondansetron and promethazine are more common medications for nausea and vomiting in pregnancy. Terbutaline can be administered to the client preparing for an external version to relax the uterine muscle for manipulation of the fetus. Hydralazine is commonly used for elevated blood pressure in pregnancy. Methotrexate, a folic acid antagonist, is used for medical management of an early ectopic pregnancy with an intact fallopian tube. The nurse is teaching the pregnant client diagnosed with HIV about methods to prevent transmission to the infant. Which information should the nurse discuss with the client? Select all that apply. 1. The client will take zidovudine PO, regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. 3. Breastfeeding should be encouraged to provide the infant passive immunity to HIV. 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. 5. All clients diagnosed with HIV must have a cesarean delivery at 38 weeks gestation. The correct answers are 1. The client will take zidovudine PO regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. And 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. Zidovudine is given orally, as directed, around the clock. The newborn should receive oral zidovudine syrup beginning 8 to 12 hours after birth until 6 weeks old. The Centers for Disease Control states that if the client is treated beginning in early pregnancy, the risk of transmission of HIV to the infant can be reduced to 1% or less. Breastfeeding is not recommended because HIV is present in breast milk. The choice of delivery method, vaginal or cesarean, is dependent on the concentration of the virus in maternal plasma. Cesarean delivery before the onset of labor and rupture of membranes can reduce the transmission of the HIV virus. However, the method of delivery needs to be individualized to each client. At a preconception visit, the nurse instructs the client on the importance of folic acid in the prevention of serious birth defects. Which statement to the nurse indicates the client needs more teaching? 1. I will increase my intake of spinach, orange juice, and almonds. 2. I will increase my intake of milk, yogurt, and fish. 3. I will take my prenatal vitamin with folic acid daily. 4. I will avoid overcooking my food to prevent vitamin loss. The correct answer is 2. I will increase my intake of milk, yogurt, and fish. Milk, yogurt, and fish are not a source of dietary folic acid. Green leafy vegetables, citrus foods, and nuts such as peanuts and almonds are rich in folic acid. A prenatal vitamin with 400 micrograms of folic acid is recommended for a client preparing for pregnancy or a client who is pregnant or lactating. Folic acid can prevent neural tube defects, cardiac defects, and cleft lip or palate. Folic acid can be lost when overcooking foods. Which medication categories are contraindicated in clients who are pregnant? Select all that apply. 1. Pregnancy category A. 2. Pregnancy category B, 3. Pregnancy category C, 4. Pregnancy Category D, 5. Pregnancy Category X. The correct answers are 4. Pregnancy Category D and 5. Pregnancy Category X. Category D medications have a proven risk of fetal harm and are not prescribed for clients who are pregnant unless the mother's life is in danger. Category X medications have a definite risk of fetal abnormality or abortion. Category A medications have a remote risk of causing fetal harm and are prescribed for clients who are pregnant. Category B medications have a slightly higher risk of causing fetal abnormalities than do Category A medications, but they are often prescribed for clients who are pregnant. Category C medications pose a greater risk than Category B medications and are cautiously prescribed for clients who are pregnant. Medications in this category have either not yet been the subject of research or may show a risk in animal studies. A nurse is facilitating a support group for people who are coping with the death of a significant other. Which client behavior reflects complicated grieving? 1. Remarrying within 6 months after the death of a wife. 2. Being continuously angry 3 months after the death of a parent. 3. Exhibiting indicators of depression 9 months after the death of a husband. 4. Keeping a child's room unchanged for 4 years after the death of the child. The correct answer is 4. Keeping a child's room unchanged for 4 years after the death of the child. Rationale. Keeping a deceased child's room unchanged for years is outside the usual limits of grieving. Often, a person can get stuck in a stage of grieving and is unable to progress to the next stage. Keeping a room unchanged for years reflects an inability to face the reality of the loss or to deal with the feelings associated with the loss. A nurse is assessing a child in relation to the stages of Jean Piaget's theory of cognitive development. Which behavior indicates that the child has reached the formal operation stage of cognitive development according to Piaget? 1. Utilizes deductive reasoning when examining alternatives. 2. Uses logical thought to organize collected information. 3. Investigates objects by placing them in the mouth. 4. Employs language to communicate with others. The correct answer is 1. Utilizes deductive reasoning when examining alternatives. Rationale. Utilizing deductive reasoning to examine alternatives reflects the formal operation stage of cognitive development. These individuals use symbols related to abstract concepts and are capable of hypothetical and deductive reasoning. A client with terminal cancer is willing to try new therapies. Which stage of Kubler-Ross stages of grieving does the nurse identify that the client is experiencing? 1. Denial. 2. Depression. 3. Bargaining. 4. Acceptance. The correct answer is 3. Bargaining. Rationale. A client in the bargaining stage of grieving seeks to avoid the loss and will try new therapies to gain more time. A nurse is considering the faith development theory by James Fowler while assessing several clients. Which clients does the nurse expect to assume responsibility for their own beliefs about faith? 1. Older adolescents. 2. Young adolescents. 3. Older school-age children. 4. Young school-age children. The correct answer is 1. Older adolescents. Rationale. Older adolescents and young adults assume responsibility for their own commitments, beliefs, and attitudes about faith. This reflects the individuative reflective stage of faith development. When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the client appears to be asleep. Which should the nurse do? 1. Withhold the drug. 2. Notify the primary healthcare provider. 3. Awaken the client to administer the drug. 4. Administer it later if the client awakens during the night. The correct answer is 3. Awaken the client to administer the drug. Administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing prescription. This is a violation of the primary healthcare provider's prescription. Drug administration is a dependent nursing function. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time. A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other clients in the dining room." Which legal term is related to this statement? 1. Battery. 2. Assault. 3. Negligence. 4. Malpractice. The correct answer is 2. Assault. The statement in option 2 is an unjust threat. Assault is the threat to harm another person without cause. The statement in option 1 is not an example of battery. Battery is the actual willful touching of another person that may or may not cause harm. The statement in option 3 is not an example of negligence. Negligence occurs when harm or injury is caused by an act of either commission or omission. The statement in option 4 is not an example of malpractice. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the client and nurse. Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice. A nurse is informed that a credentialing team has arrived and is in the process of assessing the quality of care delivered at the hospital. Which organization is associated with the credentialing of hospitals? 1. The Joint Commission. 2. National League for Nursing. 3. American Nurses Association. 4. National Council Licensure Examination. The correct answer is 1. The Joint Commission. The Joint Commission evaluates healthcare organizations' compliance with standards stipulated by the Joint Commission. Accreditation indicates that the organization has the capabilities to provide quality care. In addition, federal and state regulatory agencies and insurance companies require accreditation by the Joint Commission. The National League for Nursing fosters the development and improvement of nursing education and nursing service. The American Nurses Association is the national professional organization for nursing in the United States. Its purposes are to promote high standards of nursing practice and to support the educational and professional advancement of nurses. The client in labor has an epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? 1. Assist the client with breathing exercises during contractions. 2. Ensure the client's legs are correctly positioned in the stirrups. 3. Have the significant other scrub for the delivery of the baby. 4. Titrate the epidural medication to ensure analgesic effect. The correct answer is 2. Ensure the client's legs are correctly positioned in the stirrups. Because the legs are numb as a result of the epidural, the nurse must ensure the legs are in the stirrups correctly so that the client will not experience neurovascular compromise or any type of injury to the legs when they are in the stirrups. Breathing exercises are important, but the protection of the client's lower extremities while under anesthesia should be a priority for the nurse. Preparing the significant other for the delivery is important, but it is not a priority over the safety of the mother's lower extremities. The anesthesiologist or nurse anesthetist would be responsible for administering the anesthesia during the delivery. The nurse is assisting the certified registered nurse anesthetist in placing an epidural in a laboring client. Which findings would indicate intravascular injection of the local anesthetic? Select all that apply. 1. Tachycardia. 2. Pruritus. 3. Tinnitus. 4. Sedation. 5. Dizziness. The correct answers are 1. Tachycardia, 3. Tinnitus, and 5. Dizziness. Tachycardia is a symptom of intravascular injection of a local anesthetic. Tinnitus is a symptom of intravascular injection of a local anesthetic. Dizziness is a symptom of intravascular injection of a local anesthetic. Pruritus, itching, is a symptom of an allergic reaction. Intravascular injection does not cause sedation in the client. The nurse is caring for the pregnant client in labor. The client has had no prenatal care and reports being dependent on opioids throughout her pregnancy. Which interventions for pain control could be provided to this client? Select all that apply. 1. Epidural anesthesia. 2. Butorphanol IV. 3. Morphine IV. 4. Acetaminophen PO. 5. 1% lidocaine locally. The correct answers are 1. Epidural anesthesia. 3. Morphine IV. 4. Acetaminophen PO. And 5. 1% lidocaine locally. Epidural anesthesia is not contraindicated in the opioid-dependent client and is an acceptable form of pain management. If narcotics can be safely administered, the nurse should not withhold the medication during labor. Giving opioids during acute pain does not enhance an opioid-addicted client's chemical dependence. Acetaminophen administered orally can reduce pain in early labor. 1% lidocaine can be administered by the HCP prior to an episiotomy or for perineal repair. Butorphanol is a narcotic agonist-antagonist and should be avoided in the opioid-dependent client as it can cause acute withdrawal in the mother and in utero withdrawal in the fetus, characterized by fetal tachycardia and fetal death. The nurse is preparing to administer medication in a labor and delivery unit. Which medication should the nurse question administering? 1. Magnesium sulfate to a client diagnosed with preeclampsia. 2. Dinoprostone to a client diagnosed with asthma. 3. Betamethasone to a client who is 27 weeks pregnant. 4. Oxytocin to a client diagnosed with an incomplete abortion. The correct answer is 2. Dinoprostone to a client diagnosed with asthma. The synthetic prostaglandin dinoprostone is used cautiously in clients who have asthma because it can initiate an asthmatic attack. Therefore, the nurse should question administering this medication. The client with preeclampsia would be receiving the anticonvulsant magnesium sulfate to help prevent seizures. Therefore, the nurse would not question administering this medication. The corticosteroid betamethasone is a medication used to increase surfactant in fetal lungs and would be administered to a client who is less than 34 weeks pregnant. Therefore, the nurse would not question administering this medication. Oxytocin, a uterine stimulant, would be administered after a client has experienced an incomplete abortion to help the client expel the fetal fragments. Therefore, the nurse would not question administering this medication. The client who is 32 weeks pregnant and in preterm labor is prescribed terbutaline. Which data warrants intervention by the nurse? 1. The client's respiratory rate is 34 breaths per minute. 2. The fetal heart rate is 150 beats per minute. 3. The client's apical heart rate is 104 beats per minute. 4. The client reports no contractions. The correct answer is 1. The client's respiratory rate is 34 breaths per minute. Terbutaline, a beta-adrenergic agonist, causes bronchodilation, and if the client's respiratory rate is abnormally high, or if there is a change in quality of lung sounds such as wheezing, rales, or coughing, the HCP should be notified. The normal fetal heart rate is 110 to 160 beats per minute. Therefore, a fetal heart rate of 150 beats per minute is within normal limits and would not warrant intervention by the nurse. The client's apical heart rate is just above normal and would not warrant intervention by the nurse. Terbutaline is administered to prevent contractions. Therefore, the medication is effective. The pregnant client is prescribed metoclopramide to treat hyperemesis gravidarum. Which information should the nurse discuss with the client? Select all that apply. 1. Chew the tablet thoroughly before swallowing. 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. 4. Muscle spasms are a common side effect. 5. The medication can cause drowsiness that will make driving unsafe. The correct answers are 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. And 5. The The medication can cause drowsiness that will make driving unsafe. The medication should be taken on an empty stomach at least 30 minutes before eating. Alcohol can increase central nervous system depressive symptoms of the medication and should be avoided. Metoclopramide can cause drowsiness. The client should avoid driving until the response to medication is known. The client should swallow the medication. The client should not crush, chew, or suck on the medication. Muscle spasms and rigidity are extrapyramidal side effects and should be reported to the HCP. The client who is pregnant is prescribed ferrous sulfate. Which statement indicates to the nurse the client needs more teaching? 1. I should increase my fluid intake and fiber when taking this medication. 2. I will take a daily stool softener to prevent becoming constipated. 3. If I notice that my stool becomes black or dark, I will call my obstetrician. 4. I should take my iron tablet 2 hours after I eat. The correct answer is 3. If I notice that my stool becomes black or dark, I will call my obstetrician. Ferrous sulfate, an iron product, causes the stool to become black and tarry. Therefore, the client would not need to notify the obstetrician. The client should increase fluid and fiber to help decrease the possibility of becoming constipated. The client is instructed to take a daily stool softener to prevent constipation. Iron should be taken between meals, 2 hours after a meal, because food decreases absorption of the medication by 50% to 70%. Which instruction should the nurse include when providing discharge instructions to a client diagnosed with peripheral arterial disease? 1. Encourage the client to use a heating pad on the lower extremities. 2. Demonstrate to the client the correct way to apply an elastic support hose. 3. Instruct the client to walk daily for at least 30 minutes. 4. Tell the client to check both feet for red areas at least once a week. The correct answer is 3. Instruct the client to walk daily for at least 30 minutes. Walking promotes the development of collateral circulation to ischemic tissue and slows the process of atherosclerosis. External heating devices are avoided to reduce the risk of burns. An elastic support hose reduces the circulation to the skin and are avoided. The feet must be checked daily, not weekly. The nurse is teaching a class on arterial essential hypertension. Which modifiable risk factors would the nurse include when preparing this presentation? 1. Include information on retinopathy and nephropathy. 2. Discuss sedentary lifestyle and smoking cessation. 3. Include discussions on family history and gender. 4. Provide information on a low-fiber and high-salt diet. The correct answer is 2. Discuss sedentary lifestyle and smoking cessation. Remember to look at the adjectives. The stem of the question is asking about modifiable risk factors. A sedentary lifestyle is discouraged in clients with hypertension. Daily isotonic exercises are recommended. Smoking increases the atherosclerotic process in vessels, causes vasoconstriction of vessels, and adheres to hemoglobin, decreasing oxygen levels. Retinopathy and nephropathy are complications of uncontrolled hypertension, not modifiable risk factors. Family history and gender are non-modifiable risk factors. The question is asking for information on modifiable risk factors. A low-salt diet is recommended because increased salt intake causes water retention, which increases the workload of the heart. A high-fiber diet is recommended because it helps decrease cholesterol levels. The client diagnosed with essential hypertension asks the nurse, I don't know why the doctor is worried about my blood pressure. I feel just great. Which statement by the nurse would be the most appropriate response? 1. Damage can be occurring to your heart and kidneys even if you feel great. 2. Unless you have a headache, your blood pressure is probably within normal limits. 3. When was the last time you saw your doctor? Does he know you are feeling great? 4. Your blood pressure reflects how well your heart is working. The correct answer is 1. Damage can be occurring to your heart and kidneys even if you feel great. You should select the option that provides the client with correct information in a non-threatening, non-judgmental approach. Even if the client feels great, the blood pressure can be elevated, causing damage to the heart, kidney, and blood vessels. A headache may indicate an elevated blood pressure, but the client with essential hypertension can be asymptomatic and still have a very high blood pressure reading. This response does not answer the client's question as to why the doctor is worried about the client's blood pressure. The blood pressure does not necessarily reflect how well the heart is working. Many other diagnostic tests assess how well the heart is working, including an electrocardiogram, an ultrasound, and a chest X-ray. The nurse is teaching the dietary approaches to stop hypertension diet to a client diagnosed with essential hypertension. Which statement indicates that the client understands teaching concerning the DASH diet? 1. I should eat at least 4 to 5 servings of vegetables a day. 2. I should eat meat that has a lot of white streaks in it. 3. I should drink no more than 2 glasses of whole milk a day. 4. I should decrease my grain intake to no more than twice a week. The correct answer is 1. I should eat at least 4 to 5 servings of vegetables a day. The DASH diet has proved beneficial in lowering blood pressure. It recommends eating a diet high in vegetables and fruits. The DASH diet recommends 2 or fewer servings of lean meats, which have very few white streaks. The white streaks indicate the meat is high in fat. The DASH diet recommends 2 to 3 servings of non-fat or low-fat milk, not whole milk. The DASH diet recommends 7 to 8 servings of grain a day. The nurse just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with coronary artery disease who has a BP of 170/100. 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 98%. 4. The client diagnosed with ulcerative colitis who has non-bloody diarrhea. The correct answer is 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. The chest pain could be a pulmonary embolus secondary to deep vein thrombosis and requires immediate intervention by the nurse. The blood pressure in option 1 is elevated, but it is not life-threatening. A pulse oximeter reading of greater than 93% is within normal limits. Non-bloody diarrhea is an expected sign of ulcerative colitis and would not require immediate intervention by the nurse. The nurse is administering a beta blocker to the client diagnosed with essential hypertension. Which intervention should the nurse implement? 1. Notify the healthcare provider if the potassium level is 3.8 milliequivalents per liter. 2. Question administering the medication if the BP is less than 90/60. 3. Do not administer the medication if the client's radial pulse is greater than 100 beats per minute. 4. Monitor the client's BP while he or she is lying, standing, and sitting. The correct answer is 2. Question administering the medication if the BP is less than 90/60. The nurse should question administering the beta blocker if the BP is low because this medication will cause the blood pressure to drop even lower, leading to hypotension. The potassium level is within normal limits, and it is not usually checked prior to administering beta blockers. The nurse would not administer the medication if the apical pulse were less than 60 beats per minute. The nurse needs to assess the blood pressure only once prior to administering the medication. The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? 1. Walk at least 30 minutes a day on flat surfaces. 2. Perform light weightlifting 3 times a week. 3. Recommend high-level aerobics daily. 4. Encourage the client to swim laps once a week. The correct answer is 1. Walk at least 30 minutes a day on flat surfaces. Walking 30 to 45 minutes a day will help to reduce blood pressure, weight, and stress, and will increase a feeling of overall well-being. Isometric exercises should be discouraged because performing them can raise the systolic blood pressure. The client should walk, cycle, jog, or swim daily, but high-level aerobic exercise may increase the client's blood pressure. Swimming laps is recommended, but it should be daily, not once a week. The client diagnosed with rule-out myocardial infarction is experiencing chest pain while walking to the bathroom. Which action should the nurse implement first? 1. Administer sublingual nitroglycerin. 2. Obtain a stat electrocardiogram. 3. Have the client sit down immediately. 4. Assess the client's vital signs. The correct answer is 3. Have the client sit down immediately. Stopping all activity will decrease the need of the myocardium for oxygen and may help decrease the chest pain. The nurse must assume the chest pain is secondary to decreased oxygen to the myocardium and administer a sublingual nitroglycerin tablet, which is a coronary vasodilator, but this is not the first action. An ECG should be ordered, but it is not the first intervention. Assessment is often the first nursing intervention, but when the client has chest pain and a possible MI, the nurse must first take care of the client. Taking vital signs would not help relieve chest pain. Whenever you want to select an assessment intervention, be sure to think about whether that intervention will help the client, especially if the client is experiencing pain. Do not automatically select the answer option that is assessment. Which cardiac enzyme would the nurse expect to elevate first in a client diagnosed with a myocardial infarction? 1. Creatine kinase. 2. Lactate dehydrogenase. 3. Troponin. 4. White blood cells. The correct answer is 3. Troponin. Troponin is the enzyme that elevates within 1 to 2 hours. CPKMB elevates in 12 to 24 hours. LDH elevates in 24 to 36 hours. White blood cells elevate as a result of necrotic tissue, but this is not a cardiac enzyme. You should be aware of the words cardiac enzyme, which would eliminate option 4 as a possible answer. The word in the stem is first. This question requires you to have knowledge of laboratory values. The client diagnosed with congestive heart failure is complaining of leg cramps at night. Which nursing interventions should be implemented? 1. Check the client for peripheral edema and make sure the client takes a diuretic early in the day. 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. 3. Determine if the client has gained weight and instruct the client to keep the legs elevated. 4. Instruct the client to ambulate frequently and perform calf muscle stretching exercises daily. The correct answer is 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. The most probable cause of the leg cramping is potassium excretion as a result of diuretic medication. Bananas and orange juice are foods that are high in potassium. The client with peripheral edema will experience calf tightness but would not have leg cramping, which is the result of low potassium levels. The timing of the diuretic will not change the side effect of leg cramping resulting from low potassium levels. Weight gain is monitored in clients with CHF, and elevating the legs would decrease peripheral edema by increasing the rate of return to the central circulation, but these interventions would not help with leg cramps. Ambulating frequently and performing leg stretching exercises will not be effective in alleviating leg cramps. The nurse and an unlicensed assistive personnel are caring for 4 clients on a telemetry unit. Which nursing task would be best for the nurse to delegate to the UAP? 1. Assist the client to go down to the smoking area for a cigarette. 2. Transport the client to the intensive care unit via a stretcher. 3. Provide the client going home discharge teaching instructions. 4. Help position the client who is having a portable X-ray done. The correct answer is 4. Help position the client who is having a portable X-ray done. The UAP can assist the X-ray technician in positioning the client for the portable X-ray. This does not require clinical judgment. Allowing the UAP to take a client down to smoke is not supportive of the medical treatment regimen that discourages smoking. The client going to the ICU would be unstable, and the nurse should not delegate to a UAP any nursing task that involves an unstable client. The nurse cannot delegate teaching. You must be knowledgeable about the individual state's Nurse Practice Act regarding what a nurse may delegate to unlicensed assistive personnel. Generally, the answer options that require a higher level of knowledge or ability are reserved for licensed staff. The healthcare provider has ordered an angiotensin-converting enzyme inhibitor for the client diagnosed with congestive heart failure. Which discharge instructions should the nurse include? 1. Instruct the client to take a cough suppressant if a cough develops. 2. Teach the client how to prevent orthostatic hypotension. 3. Encourage the client to eat bananas to increase potassium level. 4. Explain the importance of taking the medication with food. The correct answer is 2. Teach the client how to prevent orthostatic hypotension. Orthostatic hypotension may occur with ACE inhibitors as a result of vasodilation. Therefore, the nurse should instruct the client to rise slowly and sit on the side of the bed until equilibrium is restored. If a cough develops, the client should notify the healthcare provider because this is an adverse reaction, and the HCP will discontinue the medication. ACE inhibitors may cause the client to retain potassium. Therefore, the client should not increase potassium intake. An ACE inhibitor should be taken 1 hour before meals or 2 hours after a meal to increase absorption of the medication. The nurse is assessing the client diagnosed with congestive heart failure. Which signs and symptoms would indicate that the medical treatment has been effective? 1. The client's peripheral pitting edema has gone from 3+ to 4+. 2. The client is able to take the radial pulse accurately. 3. The client is able to perform ADLs without dyspnea. 4. The client has minimal jugular vein distension. The correct answer is 3. The client is able to perform ADLs without dyspnea. Being able to perform activities of daily living without shortness of breath would indicate the client's condition is improving. The client's heart is a more effective pump and can oxygenate the body better without increasing fluid in the lungs. Pitting edema changing from 3+ to 4+ indicates a worsening of the CHF. The client's ability to take the radial pulse would evaluate teaching, not medical treatment. Any jugular vein distension indicates that the right side of the heart is failing, which would not indicate effective medical treatment. When asked to determine whether treatment is effective, the test taker must know the signs and symptoms of the disease being treated. An improvement in the signs and symptoms indicates effective treatment. The nurse is developing a discharge teaching plan for the client diagnosed with congestive heart failure. Which interventions should be included in the plan? Select all that apply. 1. Notify healthcare provider of a weight gain of more than 1 pound in a week. 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside. 3. Instruct client to remove the salt shaker from the dinner table. 4. Encourage client to monitor urine output for change in color to become dark. 5. Discuss the importance of taking the loop diuretic furosemide at bedtime. The correct answers are 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside, and 3. Instruct client to remove the salt shaker from the dinner table. The client should not take digoxin if the radial pulse is less than 60. The client should be on a low-sodium diet to prevent water retention. The client should notify the HCP of weight gain of more than 2 or 3 pounds in 1 day. The color of the urine should not change to a dark color. If anything, it might become lighter, and the amount will increase with diuretics. Instruct the client to take the diuretic in the morning to prevent nocturia. The client is admitted to the telemetry unit diagnosed with acute exacerbation of congestive heart failure. Which signs and symptoms would the nurse expect to find when assessing this client? 1. Apical pulse rate of 110 and 4+ pitting edema of feet. 2. Thick white sputum and crackles that clear with cough. 3. The client sleeping with no pillow and eupnea. 4. Radial pulse rate of 90 and capillary refill time less than 3 seconds. The correct answer is 1. Apical pulse rate of 110 and 4+ pitting edema of feet. The client with congestive heart failure would exhibit tachycardia, dependent edema, fatigue, third heart sounds, lung congestion, and change in mental status. The client usually has pink frothy sputum and crackles that do not clear with coughing. The client would report sleeping on at least 2 pillows, if not sleeping in an upright position, and labored breathing, not eupnea, which means normal breathing. In a client diagnosed with heart failure, the apical pulse, not the radial pulse, is the best place to assess the cardiac status. In option 3, the word no is an absolute term, and usually absolutes, such as no, never, always, and only, are incorrect because there is no room for any other possible answer. If you're looking for abnormal data, then you should exclude the options that have normal values in them, such as eupnea, pulse rate of 90, and capillary refill time less than 3 seconds. The nurse is teaching the client diagnosed with arterial occlusive disease. Which interventions should the nurse include in the teaching? Select all that apply. 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 3. Buy shoes in the morning hours only. 4. Do not wear any type of knee stocking. 5. Wear clean white cotton socks. The correct answers are 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 4. Do not wear any type of knee stocking. And 5. Wear clean white cotton socks. Cold water causes vasoconstriction, and hot water may burn the client's feet. Therefore, warm water should be recommended. Moisturizing prevents drying of the feet. Option 4 will further decrease circulation to the legs. Colored socks have dye, and dirty socks may cause foot irritation that may lead to breaks in the skin. Option 3 could be eliminated as a correct answer right off the bat because of the word only, which is an absolute word. There are very few absolutes in healthcare. The client comes to the clinic complaining of muscle cramping and pain in both legs when walking for short periods of time. Which medical term would the nurse document in the client's record? 1. Peripheral vascular disease. 2. Intermittent claudication. 3. Deep vein thrombosis. 4. Dependent rubor. The correct answer is 2. Intermittent claudication. Intermittent claudication is the classic symptom of arterial occlusive disease. The test taker could eliminate options 1 and 3 as possible answers if the words medical term were noted. Both options 1 and 3 are disease processes, not medical terms. Peripheral vascular disease is a broad term that encompasses both venous and arterial peripheral problems of the lower extremities. Deep vein thrombosis is characterized by calf tenderness, calf edema, and a positive Hohmann sign. Dependent rubor is a sign of arterial occlusive disease. The legs are pale when elevated, but are dark red when in the dependent position. Which individual is at greatest risk for developing hypertension? 1. 45-year-old African American attorney. 2. 60-year-old Asian American shop owner. 3. 40-year-old Caucasian nurse. 4. 55-year-old Hispanic teacher. The correct answer is 1. 45-year-old African American attorney. African Americans have a higher risk of developing hypertension compared to other ethnic groups. This is due to genetic factors and higher prevalence of risk factors such as obesity and diabetes within this population. Additionally, age is a risk factor for hypertension, with the risk increasing as individuals get older. Therefore, the 45-year-old African American attorney is at the greatest risk for developing hypertension compared to the other individuals mentioned. The client diagnosed with essential hypertension is taking a loop diuretic daily. Which assessment data would require immediate intervention by the nurse? 1. The telemetry reads normal sinus rhythm. 2. The client has a weight gain of 2 kilograms within 1 to 2 days. 3. The client's blood pressure is 148/92. 4. The client's serum potassium level is 4.5 milliequivalents per liter. The correct answer is 2. The client has a weight gain of 2 kilograms within 1 to 2 days. Rapid weight gain, for example, 2 kilograms in 1 to 2 days, indicates that the loop diuretic is not working effectively. 2 kilograms equals 4.4 pounds. 1 liter of fluid weighs 1 kilogram. Normal sinus rhythm indicates that the client's heart is working normally. The blood pressure in option 3 is not life-threateningly high and does not require immediate intervention. Loop diuretics cause an increase in potassium excretion in the urine. Therefore, the potassium level should be assessed, but 4.5 milliequivalents per liter is within normal limits. The phrase, requires immediate intervention, should make you think that the correct answer will be abnormal assessment data, data that require medical intervention, or are life-threatening. The client diagnosed with essential hypertension asks the nurse, "Why do I have high blood pressure?" Which response by the nurse would be most appropriate? 1. You probably have some type of kidney disease that causes the high BP. 2. More than likely you have had a diet high in salt, fat, and cholesterol. 3. There is no specific cause for hypertension, but there are many known risk factors. 4. You are concerned that you have high blood pressure. Let's sit down and talk. The correct answer is 3. There is no specific cause for hypertension, but there are many known risk factors. There is no known cause for essential hypertension, but many factors, both modifiable and non-modifiable, are risk factors for essential hypertension. Kidney disease leads to secondary hypertension. Secondary hypertension is elevated blood pressure resulting from an identifiable underlying process. A high salt, high fat, high cholesterol diet is a risk factor for essential hypertension, but it is not the only cause. Therefore, option 2 would be an incorrect answer. Option 4 is a therapeutic reply that is inappropriate because the client needs facts. When clients request information, the exchange should not address emotions. Just facts should be given. Therefore, option 4 can be eliminated as a correct answer. The male client diagnosed with essential hypertension has been prescribed an alpha-adrenergic blocker. Which intervention should the nurse discuss with the client? 1. Eat at least 1 banana a day to help increase the potassium level. 2. Explain that impotence is an expected side effect of the medication. 3. Take the medication on an empty stomach to increase absorption. 4. Change position slowly when going from lying to sitting position. The correct answer is 4. Change position slowly when going from lying to sitting position. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness, so the client should change positions slowly. The potassium level is not affected by an alpha-adrenergic blocker. Impotence is a major cause of non-compliance with taking prescribed medications for hypertension in male clients. Non-compliance should be reported to the HCP immediately so the medication can be changed. The medication can be taken on an empty or a full stomach, depending on whether the client becomes nauseated after taking the medication. To answer this question correctly, you should understand the side effects of medications. If you do not know the side effects, you may realize that hypertension is being treated and that hypotension is the opposite of hypertension and might be a complication of treating hypertension. Only option 4 refers to hypotension, providing advice on how to avoid orthostatic hypotension. The healthcare provider prescribes an ACE inhibitor for the client diagnosed with essential hypertension. Which statement is the most appropriate rationale for administering this medication? 1. ACE inhibitors prevent beta receptor stimulation in the heart. 2. This medication blocks the alpha receptors in the vascular smooth muscle. 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. 4. ACE inhibitors decrease blood pressure by relaxing vascular smooth muscle. The correct answer is 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. Angiotensin-converting enzyme inhibitors prevent the conversion of angiotensin I to angiotensin II, and this, in turn, prevents vasoconstriction and sodium and water retention. Beta-adrenergic blocking agents, not ACE inhibitors, prevent the beta receptor stimulation in the heart, which decreases heart rate and cardiac output. Alpha-adrenergic blockers, not ACE inhibitors, block alpha receptors in the vascular smooth muscle, which decreases vasomotor tone and vasoconstriction. Vasodilators, not ACE inhibitors, reduce blood pressure by relaxing vascular smooth muscle, especially in the arterioles. The 66-year-old male client has his blood pressure checked at a health fair. The BP is 168/98. Which action should the nurse implement first? 1. Recommend that the client have his blood pressure checked in 1 month. 2. Instruct the client to see his healthcare provider as soon as possible. 3. Discuss the importance of eating a low-salt, low-fat, low-cholesterol diet. 4. Explain that this BP is within the normal range for an elderly person. The correct answer is 2. Instruct the client to see his healthcare provider as soon as possible. The diastolic blood pressure should be less than 85 according to the American Heart Association. Therefore, this client should see the healthcare provider. This BP is elevated, and the client should have his BP checked frequently, but not before seeking medical treatment. Teaching is important, but the nurse must first make sure the client sees the healthcare provider for a thorough checkup and antihypertensive medication prescription. Diet alone should not be recommended by the nurse. This is not the normal range for an elderly person's blood pressure. The diastolic should be less than 85. Remember, the question asks which action should be implemented first. Therefore, there is more than one answer that is appropriate, but the first to be implemented should be the one that directly affects the client. Along with persistent crushing chest pain, which signs/symptoms would make the nurse think that the client is experiencing a myocardial infarction? 1. Mid-epigastric pain and pyrosis. 2. Diaphoresis and cool clammy skin. 3. Intermittent claudication and pallor. 4. Jugular vein distension and dependent edema. The correct answer is 2. Diaphoresis and cool clammy skin. Diaphoresis is a systemic reaction to the MI. The body vasoconstricts to shunt blood from the periphery to the trunk of the body. This, in turn, leads to cold, clammy skin. Mid-epigastric pain would support a diagnosis of peptic ulcer disease. Pyrosis is belching. Intermittent claudication is leg pain secondary to decreased oxygen to the muscle, and pallor is paleness of the skin as a result of decreased blood supply. Neither is an early sign of MI. Jugular vein distension and dependent edema are symptoms of congestive heart failure, not of MI. The nurse has written an outcome goal, demonstrates tolerance for increased activity for a client diagnosed with congestive heart failure. Which intervention should the nurse implement to assist the client to achieve this outcome? 1. Measure intake and output. 2. Provide 2-gram sodium diet. 3. Weigh client daily. 4. Plan for frequent rest periods. The correct answer is 4. Plan for frequent rest periods. Scheduling activities and rest periods allows the client to participate in his or her own care and addresses the desired outcome. Measuring the intake and output is an appropriate intervention to implement for a client with CHF, but it does not address getting the client to tolerate activity. Dietary sodium is restricted in clients with CHF, but this is an intervention for decreasing fluid volume, not for increasing tolerance for activity. Daily weighing monitors fluid volume status, not activity tolerance. With questions involving nursing diagnoses or goals and outcomes, you should realize that all activities referred to in the answer options may be appropriate for the disease, but may not be specific for the desired outcome. The charge nurse is doing shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with congestive heart failure who is being discharged in the morning. 2. The client who is having frequent incontinent liquid bowel movements and vomiting. 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. 4. The client who is complaining of chest pain with inspiration and a non-productive cough. The correct answer is 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. The client in option 3 is exhibiting signs and symptoms of shock, which makes this client the most unstable. An experienced nurse should care for this client. The client in option 1 is stable because discharge is scheduled for the following day. Therefore, this client does not need to be assigned to the most experienced nurse. The client in option 2 is more in need of custodial nursing care than care from the most experienced nurse. Therefore, the charge nurse could assign a less experienced nurse to this client. The complaints in option 4 usually indicate muscular or pleuritic chest pain. Cardiac chest pain does not fluctuate with inspiration. This client does not require the care of an experienced nurse as much as does the client with signs of shock. The nurse on the telemetry unit has just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. 2. The client diagnosed with congestive heart failure who has 4+ sacral pitting edema. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 94%. 4. The client with chronic renal failure who has an elevated creatinine level. The correct answer is 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. An S3 heart sound indicates left ventricular failure, and the nurse must assess this client first because it is an emergency situation. The nurse would expect a client with CHF to have sacral edema of 4+. The client with an S3 would be in a more life-threatening situation. A pulse oximeter reading of greater than 93% is considered normal. An elevated creatinine level is expected in a client diagnosed with chronic renal failure. The nurse is assessing the client diagnosed with congestive heart failure. Which laboratory data would indicate that the client is in severe congestive heart failure? 1. An elevated B-type natriuretic peptide. 2. An elevated creatine kinase. 3. A positive D-dimer. 4. A positive ventilation perfusion scan. The correct answer is 1. An elevated B-type natriuretic peptide. BNP is a specific diagnostic test. Levels higher than normal indicate congestive heart failure, with the higher the number, the more severe the CHF. An elevated CKMB would indicate a myocardial infarction, not severe CHF. CKMB is an isoenzyme. A positive D-dimer would indicate a pulmonary embolus. A positive ventilation perfusion scan would indicate a pulmonary embolus. The nurse enters the room of the client diagnosed with congestive heart failure. The client is lying in bed gasping for breath, is cool and clammy, and has buccal cyanosis. Which intervention would the nurse implement first? 1. Sponge the client's forehead. 2. Obtain a pulse oximetry reading. 3. Take the client's vital signs. 4. Assist the client to a sitting position. The correct answer is 4. Assist the client to a sitting position. The nurse must first put the client in a sitting position to decrease the workload of the heart by decreasing venous return and maximizing lung expansion. Then, the nurse could take vital signs and check the pulse oximeter and then sponge the client's forehead. Sponging the client's forehead would be appropriate, but it is not the first intervention. Obtaining a pulse oximeter reading would be appropriate, but it is not the first intervention. Taking the vital signs would be appropriate, but it is not the first intervention. In a question that asks the nurse to set priorities, all the answer options can be appropriate actions by the nurse for a given situation. You should apply some guidelines or principles, such as Maslow's hierarchy of needs, to determine what will give the client the most immediate assistance. The nurse is developing a nursing care plan for a client diagnosed with congestive heart failure. A nursing diagnosis of decreased cardiac output related to inability of the heart to pump effectively is written. Which short-term goal would be best for the client? The client will 1. Be able to ambulate in the hall by date of discharge. 2. Have an audible S1 and S2 with no S3 heard by end of shift. 3. Turn, cough, and deep breathe every 2 hours. 4. Have a pulse oximeter reading of 98% by day 2 of care. The correct answer is 2. Have an audible S1 and S2 with no S3 heard by end of shift. Audible S1 and S2 sounds are normal for a heart with adequate output. An audible S3 sound might indicate left ventricular failure, which could be life-threatening. Ambulating in the hall by day of discharge would be a more appropriate goal for an activity intolerance nursing diagnosis. Option 3 is a nursing intervention, not a short-term goal for this client. A pulse oximeter reading would be a goal for impaired gas exchange, not for cardiac output. When reading a nursing diagnosis or problem, you must be sure that the answer selected addresses the problem. An answer option may be appropriate care for the disease process, but may not fit with the problem or etiology. Remember, when given an etiology in a nursing diagnosis, the answer will be doing something about the problem. In this question, you should look for an answer that addresses the ability of the heart to pump blood.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.